We have 15 bills before us, and my sensibilities are that you're all really smart, that you've taken a look at those bills. Do you have a specific recommendation relative to any one of the 15 because it covers best what needs to be addressed? Anyone want to speak up? Mm-hmm.
Thank you for your question. I think to keep it very simple, and I think we all agree, that given the opportunity that was afforded by the pandemic, that we do have to continue to make telehealth permanent, but we must also be cautious with a number of the flexibilities.
But do you have a bill that you think speaks the best to, or a number of bills?
I think
I
there's...
mean, if you don't, it's not a trick question. It's okay. I just wanted to know if there's, you know, legislation that jumps out to you and fills the bill as far as you're concerned. Yes, Doctor?
I think we feel that, again, there are many elements that the bills have in common, but the Telehealth Modernization Act appears to be one that seems to incorporate the most appropriate and comprehensive approach to this.
Mm-hmm.
I would like to advocate for the Connect Act for permanency and reimbursement for telehealth for Medicare beneficiaries.
I think both of those bills, in particular the Connect for Health Act, really balance that issue of expanding access, but also putting safeguards in to ensure that we don't lead to overuse and increased spending.
Telehealth, I mean, we all agree that it needs to be extended. You know, I guess the $64,000 questions are, and how best to do this. Wherever there's money, there's someone or some outfit or plural outfits in the country that look to game it because it can become a cash cow. And that's the last thing that we want or we need. We need to be really diligent about costs. So in my view, telehealth is a convenience. It's a wonderful convenience for people. But what should not be included in services? I want to turn the pancake over. We always talk about what's needed, how are we going to pay for it? What shouldn't be included in this so that the system isn't gamed as a cash cow for organizations to just move appointments under telehealth and cha-ching, cha-ching, cha-ching? Who would like to address my question? Yes, Dr. Mm-hmm.
No, I think that you raise a critical issue, which is that we need to put safeguards into the system. We also need to recognize that the system in telehealth is evolving so rapidly, so it's hard to legislate specific examples. So I think in my view is that Medicare needs the flexibilities to address some of that overuse. So just to give some concrete examples that I feel...
Should it be that only a doctor can meet with the patient? Is it RNs that meet? Because, you know, an organization can take someone that's down in the middle of the healthcare food chain and put them online.
Yeah, I think that's a great point, and some of the legislation that's proposed addresses the issue of incident to billing, and I think that would be an important safeguard to ensure that incident to billing via telehealth there's a modifier code that's used to indicate that, so the Medicare program can track this and make sure that the patients are getting the care they need. Mm-hmm. There will also be examples of where we need to allow Medicare to target services. One of the areas that we've seen a lot of growth in, which I'm very excited about, is remote patient monitoring. But I think that there is a very appropriate idea that Medicare to say limit remote patient monitoring to the patients who are going to benefit the most, and also put limitations on who cannot get it. So those are just two concrete examples of how we need to provide and address those safeguards.
Well, my time has run out, but I can follow up with the other witnesses with submitting written questions. Thank you very much. Helpful.